Portion of today's show is brought to you by Health Diagnostic Laboratory, Inc. When it comes to knowing about your health, the folks at Health Diagnostic Labs have you covered. Their incredible testing examines every bit of your body, and clinical health consultant Carla Guffey is back now to explain about one of the markers their test touches on. Welcome back, Carla.
Hi.
How are you?
Good.
So what are we talking about today?
Well, we do have a test that is very comprehensive, included in our full lab report, that measures sterol absorption and sterol synthesis. So we're looking at how your own body absorbs cholesterol and how your own body makes cholesterol.
And so cholesterol, I always hear about good cholesterol, bad cholesterol. This test will tell you how much of each you have, correct?
It does, and the sterol testing is really important to help your doctor guide them into choosing the right medication for you if you need medication to help lower your cholesterol.
So how often, I'm assuming in this day and age with all the fast food we eat, that those numbers are usually pretty high for a lot of people.
They can be. Unfortunately, with the sterol testing, which is included in our comprehensive report, doesn't really play a lot with the diet. It's really how you naturally absorb cholesterol and how you naturally make cholesterol.
So genetics, basically?
It can be.
Okay.
It also can be affected by certain supplements that we take as well.
Like what?
If you take phytosterols, sometimes people that are high absorbers of cholesterol, those are not the best options for them to take, and it can negatively impact their cholesterol readings and their comprehensive reports.
So what can people do? What do you guys suggest? Or is this something you give back to their doctors in case you do find that the markers are kind of high?
Yeah, so it goes back to the physician, and they can help with the decision of the patient and the provider together to decide what treatment is necessary for them to help with their whole panel and helping improve their health.
So tell us a little bit more, because I know we've talked about it a lot on the show, but it's so important. Tell me a little bit more about the test that you guys do.
So for the last several years we've done, or 50 years, we've used a normal cholesterol panel to help predict heart disease. However, we're not really predicting heart disease, and so our test does more comprehensive look and more in-depth testing to give us a better outlook and identify those patients that we wouldn't normally consider risk but really are at risk.
Wow. I mean, seriously, I had one of those tests when I was like 12, like one of those blood tests, and it came back like high for cholesterol at 12, and I was told it was genetics at the time, so I should probably get mine checked to see what it is now.
And genetics plays a very huge role. And you hear about the marathon runner that has a heart attack and dies, even though they're in great shape. So it is important to have this test to identify if you're at risk.
So is that something that the Stanol, is that what it's called, the Stanol, can show you?
Absolutely. I'll use me for an example. I didn't know any of the things that I was at risk for, and this test really showed me that I absorb cholesterol a lot more. So working with my physician, I've been able to pick the right medications and supplements that work for me.
Perfect. I love it. So definitely individualized treatment based on what this test shows.
That's exactly what we're after.
I love it. Well, you can get more information about the Health Diagnostic Laboratory by going to their website, hdlabinc.com. You can also call them at 1-877-4HD-LABS. Can't wait. I'm going to get this done. We're back with more Table Talk next.
Good to see you.